all of you to stand up where you're sitting. Beautiful. All right, and I just want you to try and shake a little bit. Shake, shake, don't be shy, shake, shake. Awesome. And now what we're going to try is, we're going to breathe in, and as we exhale, we're going to create a sound that really captures the way you're feeling right now, in this moment. Okay? So, take a nice deep breath in. 1, 2, 3, and exhale a sound. Beautiful. Let's try this one more time. Close your eyes, really go deep and connect with everything you're feeling right now. And breathe in, 2, 3, and exhale a sound. Beautiful. You're so amazing. Let's sit back down, guys, and get comfortable in our seats. Now, a lot of you must be wondering why I decided to start with this breathing exercise. The reason is very simple and a little selfish. Like any other storyteller, what I need from you today is the length and breadth of your imagination. Hi, I'm Anupriya Bannerjee, and I'm a drama therapist. I'm also the founder of Dr. Drama. A lot of things in that statement need a little explanation, so let me start with why I do what I do. When I started my training as a therapist, a professor of mine, a very dear professor and a prolific drama therapist, Robert J. Landy, said, being a therapist is not a job for the faint-hearted. In the course of my training, I realized there was a lot of truth to what he said. It takes a lot of courage, a lot of strength to constantly face stories of different individuals that you can't control, that you can't predict. And if you think about it, life is just like that patient sitting in my session, right? Uncontrollable, unpredictable, overwhelming. I mean, I'm human. How do I keep holding so many stories without exploding, right? How do I function without getting consumed by the stories, the thoughts, the feelings, the emotions that go along with it? And what I found was very interesting, and I know a lot of you in the audience today would probably benefit from this. So let's talk about what self-care is, right? Okay, so there are a lot of misconceptions about self-care, all right? But before I start that, let me explain why it's important to understand that. All of you have heard of stress? Yeah? Marriage stress, family stress, exam stress. How many of you relate to that feeling? Right? A lot of you, right? So our body responds to stress through different ways, okay? But primarily by secreting different kinds of hormones. A little bit of that is good. It helps your body get physically ready to fight or fly a situation which is stressful. However, prolonged exposure to stress can start suppressing your immunity, can increase your chances of obesity, disturb your sleep pattern, cause ulcers, memory and concentration problems, and worst of all, anxiety and depression. In 2012, the World Health Organization reported that every 40 seconds there was one person committing suicide across the globe, and India had the highest estimated number of suicides. They also reported that 4.5% of our population experiences depression and 3% experience anxiety disorders. Now, I know 4.5% sounds like, what? Nothing. But think about 1.2 billion people and then do the maths. Pretty big, right? Well, coming back to then, how do we attend to that, right? Something as simple as self-care can help you keep anxiety disorders, keep depression, keep mental illness at bay. There are some misconceptions floating around about self-care though. A lot of people think that binge watching Netflix, spending long hours on your phone or on the internet, YouTube, Facebook and all, hanging out with your friends count as self-care, but I'm very sorry to burst that bubble. That's not self-care. No, it isn't. Okay, let's try this. all of you, think of one thing that you do that you think is self-care, whatever it is, all right? And ask yourself these two simple questions. One, is that time that you practice self-care in solely and wholly dedicated to you and what you want to do? And two, is it something that allows you to be truly aware and connected to the way your mind, your body, your spiritual self feels? In short, is it something that allows you to be mindful? If you said yes to all the above questions, you're good. My speech is done. You get what I'm talking about. You know self-care. Awesome. But if there's anyone in this audience who's feeling slightly confused about how to feel about their self-care ritual, I hope the next part kind of clarifies that for you. So let's talk about how drama therapy, what I do, helps self-care. All right, I'm going to ask you to use your imagination. Pretend like you have a camera in your hand right now, okay? And your task is simple. You have to take as many pictures as you can of this beautiful person standing right next to me. Yes, you. Yeah. So, if that's your task, can anyone tell me how many pictures would you be able to take of her? 10, 100, 50, 1,000? Any guesses? Well, I'll save you the trouble. The right answer is there is no right answer. Okay? There are infinite ways of looking at her, right? Drama therapy is just like that imaginary camera that you were holding in your hand for a second. It allows you to see a person, a story, from multiple lenses and multiple possibilities. It's a strength-based approach that combines the best of psychotherapy and techniques of theater like art, music, movement, dance, role play, masks into the process of therapy and caters to individuals who need to have a little bit of help unearthing, understanding, and connecting with their truest self in the here and now. So, that's what drama therapy is. But then how does it attend to mental illnesses? Let's talk about someone who's experienced trauma, maybe. Imagine someone who's experienced something like war, death, rape, violence. All right? Now, what we don't see about this person is that their Broca's area is slowly shutting down as a response to their PTSD. Now, the Broca's area is that part of the brain that basically controls the way you communicate, the way you speak. And in therapy, what is our focus? Say something. Get it out of your system. Verbalize it, right? Drama therapy takes away the focus from verbalization and channels it into a metaphorical container. So, for example, what I do in a session is I'd use something like letter writing. Write a letter to a part of you or to someone that you want to communicate more with. You don't have to send the letter. Just get it out of your system. Maybe even use something like sketching, coloring, a mood mandala that captures the way you're feeling in this moment. Did you know that music and movement release the same kind of hormones that antidepressants and anti-anxiety pills release? That improvised behavior, spontaneous behavior, can charge up more parts of your brain than rehearsed patterns of behavior. That's exactly what drama therapy does. It breaks the pattern of behavior that you're used to and allows you to simultaneously explore who you are and safely contains whatever's coming up for you in a therapeutic space. All right, let's imagine someone on the autism spectrum. Or you can imagine Shah Rukh Khan from My Name is Khan, right? The Diagnostic Statistical Manual says that someone on the autism spectrum is typically characterized by repetitive behavior patterns, deficits in communication like not being able to make eye contact, not being able to verbalize. A drama therapist could see something like hand flopping and channel it into playing drums. You could use something like masks and face painting to build eye contact and thereby build empathy and communication between caregivers and an autistic person. How wonderful is that, right? All right, I'll share a story with you guys about this patient I worked with. A few years ago, when I was studying to become a drama therapist, I happened to be interning at an acute psychiatric ward. Now, typically what you'd meet in there is patients diagnosed with severe kinds of mental illness like personality disorders, anxiety disorders, depression, bipolarity. All right, you're getting the feel of it, right? This story is about someone who was diagnosed with schizophrenia. His name is Raymond. It's not actually his name, but for now, we'll say his name is Raymond. Before I come to who Raymond was and what he was experiencing, I want to talk to you a little bit about what schizophrenia is. And again, I'm going to ask you to imagine. Take in all this, the lights, the person sitting next to you, the cameras, the stage, me, and this person standing next to me. All right? Now, what if I told you this person isn't real? She's a figment of your imagination. How are you feeling right now? Isn't it scary yet beautiful to be able to see something and hear voices that only you know about? To have a world living inside your head that only you can see. You know what you need is sometimes you need is that ability to just break away and enter a different world. Because Dumbledore once said, all right, that, well, of course it's happening in your head, but that doesn't mean it's not real, right? So in traditional psychology, there was this technique called reality testing, which basically meant telling someone like Raymond that, no, your delusions don't exist, your hallucinations don't exist, they have no basis in reality. Just play back how you felt when I told you that she might be a figment of your imagination. She's real, she's standing right in front of you, but I'm telling you she's not here. That's the same feeling for someone experiencing schizophrenia. Now, enter drama therapy, where you have this realm called surplus reality, this fictional play space where you can tap into the uncensored creative core of somebody and let them just explore freely. So coming back to Raymond, all right? Raymond was someone who was facing a lot of difficulty at the hospital. He was not adhering to his medication. He was isolating, staying in his room, not coming out and interacting with, the rest of his peers in the hospital. And nothing we did seemed to be working. So what happened was, I was walking by his room one day and getting ready to invite him for a group activity. And I noticed that he was looking very distressed and scribbling numbers in very aggressively into pieces of paper. So I went up to him and I asked, hey, Raymond, what's up? Yeah, you're looking really stressed. What's wrong? He said that I have to get these numbers fixed. I have to send this in. It's not working. It's not working. So I said, what's not working? He used the next 10 minutes to explain to me that he is a spy for the White House and he is decoding complex numbers that enemy territories have created to attack the president's soul. Can you imagine using maths to attack someone's soul, right? So what I said was something to the gist of this in that moment. I said, Raymond, look, I know you're super duper busy, but if I can just have one moment of your time, I know you have to serve and protect the president. It's a big job, but you know what? You can't keep doing something without taking a break. You really need to relax. Tell you what, if you come away with me for just 5-10 minutes and just relax and just try something that you want to do, all right? I promise you're going to come back and be more efficient, be more productive with your work for the president. Does that sound like something we can do? Just 5 minutes. If you don't like it, you can come back to your room immediately. I won't pressurize you, I promise. But is that okay? Awesome. So what happened for the next 45 minutes that the group was on was Raymond did come to the creative arts therapy room. He sat and made an artwork that reminded him of the need to take care of himself, to relax. And he associated with 10 other patients on the unit all the things that we were saying, right? He's not compliant, he's isolating in his room, he's not understanding the need to break away from his voices. All of that was sort of served in this moment by me entering his reality and he entering a little bit of my reality, and we finding a bridge in between. If there's anything I want you to get from this story and take back, it is this. Please do not discount self-care. It's so simple and yet so effective in helping you ensure your mental health and well-being. Be it 2 minutes of meditation, 5 minutes of walking, 10 minutes of jogging, half an hour of dancing, prancing, singing, doodling, coloring, drawing, scribbling, gardening, cooking, whatever your way may be. Find that time in a day, in a week, to give yourself space and permission to check in with yourself. I like to end with one more story that's very close to my heart and really encapsulates the way I feel about drama therapy. It's a story that takes place between Dr. Sigmund Freud, who's the father of psychology, and Dr. Jacob Levi Moreno, who is the father of psychodrama, a technique in drama therapy. So Freud asked Moreno, what do you do? And he's a 23-year-old medical student. And he responds to Freud like this. He says, well, Dr. Freud, I start where you leave off. You meet people in the artificial setting of your office. I meet them in their natural surroundings, in their home, on the streets. You analyze them and break down their dreams. I give them courage to dream again. You analyze them and tear them apart. I let them act out their conflicting roles and help them put their parts together again. I hope that this conversation was able to unmask what drama therapy is and what it means to me. Thank you so much for bringing your fullest self. Take care and keep loving yourself.